Greetings, we just do an audio check. If you can just confirm you can hear me, please. And you need to allow me to share screen, please, as well.
Yes, we follow.
Good.
We understand.
Good. I'll just get the admin team to give me sharing rights and then we can put the screen up.
Okay.
It'll be a few minutes yet before we start. We're just getting ready. Good.
Hi, Prof. Andy.
Greetings, how we doing?
Yeah, I'm doing great. How are you doing, Prof?
We move along. Time's been hard. It's late at night for me, but never mind. I think it's a good time for you.
Yeah.
So
Yeah. So in the meantime, Prof, Priya is not there with us today. So I'll be there to assist you. So if you need any support from my side, please let me know.
okay, well, let's see how we go. If we stop, you might have to take over sharing the slides. I hope you have the slide deck there.
Yeah. Sure.
So
Just let me know, Prof. Yeah.
I'm on quite a good internet connection, so I hope we'll be okay here.
Yes. I do have.
Good.
Yeah. Thank you.
Right, good. So a few minutes and then we'll be
Yeah. Sure.
making a start. I see we have 17. I think we have a few more to go yet.
Good morning, Professor.
Greetings and good evening from me as we come to late night here in Thailand. Okay.
Oh,
And
yeah, sorry. We are in
no
morning
problem.
here.
Morning, you. We're in many time zones today. So yes, we're across the world.
Yeah,
For those in the Americas, yeah, it's early morning. For us, it's late at night.
yeah, early morning, yeah.
And Eid Mubarak to all our friends out there and happy May Day. Okay, we have 20. We'll give it another few minutes to come up to time. Okay, we're just on time, just 2 minutes until we get up to 30 people, and then we'll make a start. Okay, we're at 30 people now, so we'll make a start. Firstly, good evening, good morning, good afternoon. Thank you all for joining us. I'm sure by now you're all familiar with the format of these webinars. Today, we're going to look at Module 10, the final case study around PSM plans. So PSM plans and donor grant applications for funding. Our usual housekeeping announcements, please go to mute and turn off your video. You can ask questions at any time using the chat box. During the quick Q&A sessions, please use the raise hand icon to ask a question, and we'll invite you to unmute and then speak. The webinar recordings will be available to you, and the slide deck will be shared as usual with all participants. So the main objective is to summarize the module and give you a chance to ask questions. And really will be in two parts. I'll talk first about PSM plans, why we have to do PSM plans, then a short Q&A session, then how to do PSM plans, and a second Q&A session. So first, why we do PSM plans, and that helps us to understand how to do them. So understanding why we need PSM plans is quite important. I'm sure by now you're all familiar with my voice and have heard it many times and many hours through all the modules. So main point is, when I talk about PSM plans, every donor and every ministry has their own format, their own system for PSM plans. So I'm going to talk about the Global Fund, the TGF PSM plan, because that's the one that most countries have difficulties with, and that's the one that generally brings the most money. It's also the one that's best documented. Now, when I say that, I don't mean it's all that good. The Global Fund documentation is not always that clear. It's not always so easy to understand, and I'll try and explain some of it today. But for sure, the Global Fund documentation is the best of all the different donor PSM plans. At least it is systematic, at least there's a template, at least it is well laid out, even if sometimes it can be complicated. A word of caution, it often changes. It changes without notice, without anyone ever telling you, and the URL website links change by the hour. So even though I put links in this presentation, when you come to follow them, they might not work anymore. Right now, all the WHO and Global Fund links are changing every day. They're trying to fit in all the COVID material, so they're moving everything off into remote servers, and that means changing the link all the time. So first of all, what is a PSM plan? And we need to understand that it is a legal, contractual, financially binding statement. You promise in law, in finance, morally, ethically, contractually to do certain things. If it's in the plan and you don't do it, sanctions can be applied, and in the case of Global Fund, will be applied to your country and to the individual officers. When the country signs the Global Fund grant, they agree to follow all the Global Fund rules. And that means paying the fines and debarring officers if they breach the rules. So it is an international contract between the government of the country, usually, and the agency, which in our case is going to be the Global Fund, but it could be USAID, it could be DFID, it could be any of the donor agencies. Main point to understand, it's a contract. It is legally binding. So we have to think carefully about what we're going to write in there. Because if we get it wrong and don't do it, the country can be sanctioned. Why do we need this PSM plan? Because of the golden rule. What is the golden rule? The one with the gold, they make the rules. Who has got the gold? The donors. So they make the rules. And each donor has slightly different rules. We have been trained for nearly 30 years to get the donors to harmonize the rules. We haven't achieved it yet. It is better, they are closer, but they are not fully harmonized yet. World Bank has slightly different rules to Global Fund, which are different to USAID, which are different to DFID, which are different to Dutch and German aid. So we have to be aware of the donor rules, and we have to follow the donor rules, because I'm making a legally binding contract in my PSM plan. And we have to follow ACTA, which is the anti-corruption, transparency, and accounting mechanisms. So right now on the global donor aid market, it's estimated that nearly $500 billion goes in fraud, is lost. And round about 140,000 children die annually because the medicines, the healthcare they should receive, which is being paid for, is being stolen and diverted. There is a major problem on fraud and corruption around donor aid. If we look at the particular case of the Global Fund, just 4 countries, there was a fraud of $34 million, just in 4 countries. The Global Fund works in over 90 countries. There are regular reports of drugs being stolen, misused, misappropriated, inflated prices being paid. It's a problem throughout. That's one of the reasons why we need this PSM plan, and the donors insist on having a very clear PSM plan where you promise contractually, legally, financially what you are going to do. This is a little hard to read, but it's from the Global Fund report on the cost recovery. That is countries who did wrong. And the Global Fund is fining them, is charging them. And here you can see a list of all the charges from Afghanistan through to Kenya. The list goes right down to Zimbabwe. Here we can see a charge of $4 million, misappropriated, not spent correctly. And you can see all the different amounts. This report is from 2020. It's still a problem now. This fraud and corruption and misuse and mismanagement that is going on. This is what drives the need for the PSM plan. If we look at the situation in Malawi, they put in a new system for whistleblowers to report fraud and misuse of funds. In just 2 months, they had over 100 reports, a massive amount. The Global Fund Secretariat continues to raise and now provides training in how to prevent misuse and fraud of its funds, of the medicines that are supplied, making sure that they get there. They call it the Speak Out Now program. So lots of activities going on to reduce the amount of fraud and misuse. This misuse has become such a level that a number of countries, Sweden, Germany, Denmark, and the European Commission stopped funding the Global Fund. They said, no, we're not going to give you any more money. Stop everything until you solve this problem, until you stop the fraud, until you stop the misuse. This is why the PSM plans have become much stricter, much more complicated, more financially and legally binding. One of the activities that Global Fund did was to bring the PPM, the pooled procurement mechanism. That is, you must buy it through the Global Fund WAMBO system. You can no longer buy it on your own by the country. This has greatly reduced the amount of procurement fraud. We've seen much less of overinflated, padded prices, a reduction of 80% in reports of procurement fraud. Unfortunately, there's been an increase in the number of drug thefts from storage facilities, data fraud, survey fraud, and salary kickback schemes. So they're claiming salaries for people who don't exist, so-called ghost workers. PSM is charging for its function for staff it doesn't have. Global Fund's becoming much more adept at catching that now. That's one of the reasons for this detailed PSM plan. So why are the donors doing all this? Because now they must observe due diligence. If they don't, then the major people who put the money in, the individual high-income country governments, will stop funding, just like Germany and Denmark have stopped funding. So they're now going to check, and they're going to check that they've checked, and they're going to check that the checks have been checked. And that means we must produce a clear PSM plan, which deters, which limits the potential for any fraud and losses, and make sure that we can detect fraud if it does occur. So we call this process due diligence. And increasingly now, Global Fund, the local funding agent, will be looking for due diligence in the PSM plans. Well, is it really necessary? We've had Global Fund grants for 20 years. We've been doing this PSM plan for 20 years. This is an extract on the screen now of a Global Fund report from last year. The procurement and the supply management plan was developed without any input of the relevant officers. What does that mean? They never spoke to any PSM people. The government just made the PSM plan and never talked to PSM. So we have a very weak administration from the start. They then agreed that PSM would charge 13% of the commodity cost. So we would pay the procurement and the supply chain staff out of that amount, 13%. But they actually charged 90%. Was that cheating? Or was it just incompetence because people didn't know what they were supposed to do? A large amount of computer equipment was provided for PSM functions, but was just left idle at the sites, was never used. And it included $6,000 for training PSM staff, which never got done. This is just 2 years ago, just one country, a typical report. That's why we need this detailed PSM plan, exactly what we're going to do, who is going to do it, how are they going to do it, and how are they going to report what they've done. More recently, we've had COVID, and Global Fund has produced funding for COVID commodities. And here we see, again, big challenge. Didn't happen as well as it should have done because procurement didn't work. In-country processes and administrative bottlenecks. So much paperwork to do in country, we couldn't make the supplies move. A common problem needs sorting out in country as well. And that means a reasonable assessment of the capacity of the country to undertake procurement and supply. We've had 20 years of Global Fund grants, and frankly, most PSM systems are no better now than they were 20 years ago. We're still seeing 38 countries still have major problems on procurement, still paying above the market price for medicines, weak quantification, lots of stockouts. Why are we still having this problem? Often because we've never asked for any money for PSM. Countries have only asked for money for the commodities. There's never been a plan to strengthen the PSM system. And we've never asked Global Fund to strengthen the PSM system. Less than 20% of grant applications to the Global Fund include any money for PSM. If you don't ask for it, you will never get it. If you do ask for it, you might still not get it, but at least you've got a chance of getting some money for PSM and to strengthen PSM and to undertake training. So fundamentally, the point around the PSM plan is to try to force a country to think carefully about how it is going to do the PSM. How are you going to make it work in future? And that's already a problem. How many countries have the basic KPI, the key performance indicators? The end of last year, we did a survey in Southeast Asia for COVID-19 commodities. So we asked countries, how many of you know the fill rate? When people requisition gowns and masks and gloves, how many orders can you fill? Only a quarter of countries knew. 75% of countries didn't know what their fill rate was. None of the countries knew what their stock out rate was, or how many days they were out of stock, or what the expiry rate was, or what the damaged good rate was, or what the holding cost was, or what the transport capacity was, or even the procurement value in stock. None of them knew. Why should donors give you any money when you've got no idea what you're doing? There is no operation in the private sector that doesn't have these parameters immediately available. They know exactly what their fill rate is, how many days they're out of stock, and what their holding cost is. We have to improve, we have to get better, and that means we have to measure our PSM system. So in the PSM plan, how are we going to measure? How are we going to monitor what we're going to do? How many countries know what their supply chain maturity level is? Well, the answer is 21. Unfortunately, there are 192 countries registered with the World Health Organization. So what's the maturity level? How good are you at import, wastage, loss, lead times? How many of you have measured this using the UNICEF maturity level tool? Very few. We're not measuring. We're not looking at what we're doing, and yet we're asking for millions of dollars in grant aid. Now, donors don't expect your PSM operation to be perfect. If it was, they wouldn't give you any money. But you must be realistic in stating the current capacity and capabilities. What can you do? And that's difficult to prove if you don't have KPI. You can start by saying, we don't know now what the KPI is, but we've got a new system to measure them, and we're going to start measuring and reporting them during the course of this grant. You cannot just keep saying, I will do better next week, next time, we'll do better in future. You've got to going to state how you're going to make it better, a clear plan. And you've got to state who, in the sense of which body, which organization, is going to be responsible to make it better. And who is going to pay for it to make it better. You can ask for Global Fund money to pay for training, to pay for new systems development, to pay for implementation. And again, less than 20% of Global Fund grants contain any budget for PSM strengthening. We're not asking for the money to make it any better. And we've got to change that. You'll only receive the money if you ask for it. It's not guaranteed that you will receive the money even if you do ask for it. But if you don't ask for it, there's no chance you will receive it. What are the common problems on PSM plans? Often it's cut and paste. We take the last grant PSM plan, or we take the PSM plan from another country, just cut the text and paste it in. Doesn't fit, it doesn't work. That's not how our country operates. Second problem, the PSM budget does not match the project grant budget. If I say in the grant application, I'm going to treat 2 million people for HIV, and I order enough medicine for 1 million people, how does that match? How does it work? If I say I'm going to treat 2 million people for TB, and I order medicine for 4 million people, how does that work? It doesn't match. It has to match together between the main grant application and the PSM plan. All donors have a list of approved products. Global Fund's list is clear. You can find it on their website. They will only fund certain products. They won't fund everything. They'll only fund certain times and certain formulations. So for TB, they have one formulation of fixed dose combination. Some countries want a different formulation. Sorry, they don't do that. They'll only approve the formulations on their approved products list. Some countries want X-rays for TB. Highly unlikely that Global Fund will pay for that anymore because they want diagnosis by gene expert, by laboratory methods. These products, these commodities require a full quality assurance plan. How are you going to do it? do you have a quality assurance laboratory in your country? Most countries don't for particular products. Fixed dose combinations for TB or for malaria are complicated. It's difficult laboratory analysis. It requires specialist laboratories certified to ISO standards. So Global Fund wants to see a clear quality assurance plan, which you will send it internationally to an appointed laboratory, naming the laboratory you're going to use. And how are you going to get it there? Might use DHL, FedEx, some other system to make it work. They want to see a monitoring reporting plan. How are you going to measure what you're doing? Currently, less than 50% of PSM plans get approved on first submission. They're submitted, they're rejected, revise it. Get the budget to match. Where's the QA plan? Where's the monitoring plan? If that's not included, it will be rejected. And then the whole grant is delayed. No money flows until the PSM plan is sorted out. Most of them need major reworks. It's a major problem area. Okay, let's pause now for our first Q&A session. You can type in the chat box or you can raise your hand. Okay, nothing in the chat box yet. If you want to raise your hand, and I'll come to you if you want to ask a question. So type in the chat box or raise your hand and I will ask you to unmute. I don't see any hands. I don't see any messages in the chat box yet. Everyone a bit overawed. Huh? Okay, if it's easier, just unmute and ask a question and we'll see. Okay, Pradeep, I see you're unmuted. Do you want to? Okay, no questions yet. Okay. Is there any cases from which the Global Fund had problem by itself? Yes, Global Fund has made problems too. You will find in its audit reports, Global Fund often says it's very slow to approve grants. It's very slow to give the money. That's caused delays and problems to countries as well. So Global Fund is partly to blame for some problems in slow disbursement, slow approvals, slow disbursement of funds. Why more rejections of the PSM plan in Global Fund applications? Usually because the PSM plan is just too weak. It just doesn't have the information and it doesn't match. The numbers have to match. You can't have 2 million people in the grant application and only 1 million in the PSM plan. Numbers have to match all the way through. And that's difficult because you are not in charge of the main grant application. Often that's run by Ministry of Finance and they keep changing their numbers all the time. So it's difficult to match up the numbers. As PSM, we have to try and do that. Can countries be allowed back for global fund grants after being blacklisted. There is no global fund blacklist, countries are sanctioned. But yes, is the simple answer. And World Bank does run a blacklist, but again, yes, it is for a period of 2 to 4 years usually, but yes. Usually Global Fund will seek to recover funding. It may take the administration of some aspects away from the government and give it to a UN agency. So in some countries, the Global Fund grant is administered by UNDP because they feel the government just doesn't have adequate strength and reporting systems to manage such large volumes of money. But Global Fund does try to give the grant to the host country if at all possible. What about individuals? No, individuals are usually removed completely. If individuals are found to be involved in fraud, then they are debarred from Global Fund activities in the future. Okay, I'll move on to part 2, and then perhaps there'll be more questions at the end of the second session. So first of all, one of the main problems with PSM plans is it's often not the PSM staff. It's often not you who get to write them. Sometimes it's a remote project team based in the Ministry of Finance. They don't really care about PSM. They're not bothered. They're all clinicians. They're all caring about patients and treatment mechanisms and what the standard treatment guidelines will be. And we've seen comments from the Global Fund audit reports where they say the PSM plan was developed without the input of any PSM people. Not surprisingly, it didn't work. Other countries fly experts in. You just bring a consultant for 4 or 5 days, he writes the PSM plan, bang, off he goes. Well, it will probably get approved. Consultants are very good at knowing what the donor wants to see, but that doesn't mean it will work in your country. So step 1 is for the PSM people to take charge of the PSM plan. And that means you have to be prepared and ready, that you have the skill sets to know how to make a PSM plan. And that's what the case study in this module is all about, getting you to go through the process, starting to make part of a PSM plan, so that in future, hopefully, you can be part of the team that writes your country PSM plan, and it's not left to a little office in the Ministry of Finance to do it. So the main point about PSM plans is they're often far, far too rushed. You have to take the time to think what you're going to do, how you're going to do it, who is going to do it, and what resources do they need. We have to plan the plan. So we use our regular statement, failing to plan is planning to fail. You have to allow enough time to think about all the different areas. How is it going to work? How are you going to do it? How is the different parts going to come together? We start with, what do you want to do? And that will be a public health goal. And that will come from the Ministry of Health. How many patients are you trying to treat? That's the starting point. Then we can look at morbidity-based quantification to calculate how many diagnostics and how much medicines and other supplies I would need for the treatment. So my starting point is, what am I going to do? I'm going to try and reduce the amount of malaria in the country by treating patients for malaria. In order to treat them, I first have to diagnose them. So I need diagnostics and medicines. How are you going to do it? I'm going to provide health commodities to diagnose and treat patients. When are you going to do it? A clear timeline. When is it going to start? When is it going to end? What capacity do you have? How much warehouse capacity have you got? What transport capacity have you got? What skill sets are available? What staff numbers have you got? If I'm going to order enough medicines for 2 million TB patients, how much capacity in the warehouse do I need? And you will find on the Global Drug Facility website a means for calculating the cubic meters. And make sure that you've got enough. And if you haven't got enough, you may have to rent warehouse space. That will be part of the PSM plan. What resources do you need as PSM? You're going to need money, you need technical support, you need training perhaps. TB medicines are changing all the time. Perhaps we need training around the MDR TB medicines on quantification. That would be a good point, a good thing to ask for in the PSM plan. What's the risk something can go wrong, and how am I going to mitigate the risk? What's the risk the warehouse can catch fire? It happens. Ghana, 3 years ago, yeah, Tema warehouse caught fire. How am I going to mitigate those risks? By keeping the stocks in more than one place, by having good fire protection. Finally, what's it going to cost and who's going to pay for it? Who's going to pay for the extra warehouse space? Who's going to pay for the extra trucks? Who's going to pay to make it all happen? So we start just by thinking about these areas, not detailed calculations yet, just thinking about who, where, what, and how am I going to do things? And that's why we need time. Where am I going to get the information that I need to put in the PSM plan? Well, many countries already have a World Health Organization Global Fund pharmaceutical country profile. In these profiles are a lot of information which I will put into the PSM plan. Not every country has one, but a lot do. You'll find them online. You have to hunt and search for them because, as ever, WHO keeps changing the URLs every hour. So you have to work hard to find them on Google. Here is an example of a recent one from Myanmar, Burma, that was 2017. You can see it states the population, GDP, how much is the health spending, how much is the spending on medicines. Why do I need to know the spending on medicines? Well, if I'm going to ask for 4 times more than the country is spending, I probably don't have enough resources for warehousing and transport to make that happen. So that's one of the considerations that Global Fund will check. What's your total spending on medicines? How much are you asking for now? Is it a reasonable percentage? Then how much are you spending on malaria and various other diseases through the system? How many pharmacists have you got? How many doctors have you got? Could you actually do the program? If you provided all this medicine, is there enough doctors to actually dispense, diagnose it? So these country profiles were developed with WHO. Countries put together most of the information. WHO sent experts to assist. The idea was it should be done every 4 years, update them and get all the information together. That will help you on all grant applications and especially on the Global Fund PSM plan. Not all the information you need is in the country profile. but it's a good base to start producing the PSM plan. And there are country profiles for all of these countries here. Again, you have to search for them. The URLs change every day as they get parked in different parts of the WHO server. What's in the country profile? The health and demographic data. So population. You're going to start with that. Which population figure are you going to use? There's usually lots of population figures. World Bank has some, WHO has got others. Use the one from the country profile. Similarly, on the health service, the policies, medicines, trade and production. Is your country exempt from intellectual property rights? Low-income countries are exempt. Middle-income countries, low and middle-income countries, not so clear. You need to look at the detailed exemptions, otherwise you could get into intellectual property problems. Pharmaceutical procurement and distribution, how much capacity do you have? How much can you do? Have you got a rational drug use committee? Have you got a selection committee? And then what is the household data? How many people are around? I need that for items like malaria bed nets, which are provided per number of households. 1 net, 2 nets per household. So that will help me calculate the number of nets that I need. Not all of them are infograms like the Myanmar one. Some of them are typed data reports like this. You will see what's the pharmaceutical expenditure, 25% of the health expenditure from the MHO report 2019. What's the public expenditure on pharmaceuticals, 41%. So in this country, 60% comes from the private sector and around 70% are generics. That information is in the pharmaceutical country plan. So what does the donor want to see in your PSM plan? There's a full guide to the Global Fund policies, June 2021. The link is on the screen. It was working yesterday. I don't know if it is today, but I hope so. If not, you will have to find where it is today. They want to ensure that you've got adequate procurement and supply management. If you're going to treat 2 million people, you've ordered enough medicine for 2 million people. You've got a big enough warehouse, you've got enough transport, or you're going to rent a warehouse, you're going to contract transport. A reasonable capacity assessment. If you need strengthening, that you have asked for some technical assistance to strengthen, and that could be training. How are you going to buy the pharmaceutical products? How are you going to buy the diagnostics and laboratory items? Vector control for malaria. How are you going to buy the insecticides and sprays and bed nets and all the other items to stop mosquitoes? Male and female condoms, how are you going to buy them? Personal protective equipment for COVID, how are you going to buy that? And then all the other health products you need to make it work. What about waste management? How are you going to dispose of all the products after you've used them? How are you going to destroy the expired medicines or the damaged medicines? What's your waste management system? And how are you going to report the prices and what's happened? How are you going to undertake monitoring? That's what the donors want to see in your plan. Start by reading some PSM plans. Get an idea of the level of detail that's required and the linkages that are required. So in this example here, who is going to be doing what? It tells you the National TB Control Program working with the Department of Medical Supplies. So the two working together are going to look at distribution and coordinating distribution. How are you going to do it? You're going to strengthen the medical stores. How are you going to strengthen them? That's all listed out in paragraphs 514, 5110, 1112. So you've got details of how you're going to strengthen the system to do it better this time. And you're going to integrate them into the national supply chain. Because in the past, you did it all separately through the TB program. It went directly to district stores and there was no records and no monitoring and nobody could track it. Now we're going to try and put it through the central supply system, and these detailed paragraphs explain what we're going to do and how we're going to do it. That's the kind of information we need. Very clear who, how, what. There is a template to guide you through the whole process. That's the guide to writing a procurement and supply management plan. Link is on the screen to get the template to go through step by step. But again, before you start, look at some PSM plans, get familiar with the idea of what you're going to do. So, first page. For the case study for this module, you do not need to undertake the quantification and enter the quantities or the values. So you do not need to complete this table. What you need to complete is all the words about how you're going to do it, not the detailed quantification. That's too much for now. We're going to look at just trying to complete the basic plan. So we start off the PRs, that's the principal recipient management capacity. So the person in charge at the Ministry of Health, who is going to do what? Who is in charge of the procurement policy and system? You've probably got a procurement unit, and they report probably to the Ministry of Health. They might report to the Ministry of Finance. Now, what type of organization is it? Do they need any additional staff? Well, if I'm going to increase the procurement, maybe they do. Quality assurance and quality control, who is going to do it? It can't be procurement, because that would be a conflict of interest. Remember that from the module on procurement? Who's going to do the quality assurance? Who's going to go and take the samples, seal them, and send them off to the laboratory for quality assurance testing? Which organization? Do they need any technical support to do that? One by one, working through all the questions. International and national laws, the patents. What's your intellectual property rights? Depends on the country. Low-income countries, you're usually exempt. Other countries, not so. Coordination. Often more than one donor is involved. HIV, there might be 4 or 5. There might be Global Fund, there might be PEPFAR from USAID, there might be European Union, there might be World Bank, all funding some parts of HIV. Who's going to coordinate all of this? Who's going to put it all together? How are they going to do it? Do they need any strength? Who decides which products are selected and which are going to be used? Is there a national drug selection, a national drug and therapeutic committee? Who's going to do the forecasting all the way through? So the plan is forcing the country to think about what they're going to do. Item by item, working slowly through who is going to do it. Can they do it? Yes, perhaps in many countries, some, they will need additional strengthening. So forecasting, which process are you going to use? You're going to use morbidity? Are you going to use consumption? How are you going to calculate it? Are you going to have a quantification committee? Who's going to be on the committee? I don't need the names of people. It's the organizations who are going to be on the quantification committee. Procurement planning, how are you going to do it? But with Global Fund, increasingly, you don't have much choice. You're going to have to go through the pooled procurement mechanism and use the online WAMBO ordering. But there'll be some items like PPE, personal protective equipment, that you might want to buy locally. So think about how you're going to do it, who's going to do what. And then the issues around procurement. Inventory management. Have you got enough warehouse space? You got enough transport capacity? Who's going to make the calculations? You don't have to make the calculations for this case study. What we do have to say is who is going to do it? How are they going to do it? And it's not one size fits all. Different commodities might require different approaches. So for example, if you're doing malaria, you might want to order insecticide-treated malaria bed nets. These are heavy, bulk items, and mainly they're issued one time. We don't do it every week like pharmaceuticals. It would be perhaps once every 2 or 3 years with just a few in stock for a few extra households that might come along. So do I really want to put that item through my normal supply system? Perhaps it would be better to contract it out to a company to deliver them. Also, do I want insecticide nets next to my medicines in the warehouse? Is that a good idea? So high bulk items like this, perhaps I'm going to have a different supply system for them. Perhaps I will rent a warehouse or use a contractor to do the distribution for me. Similarly, on insecticides for vector control, I don't want these poisonous chemicals in my medical store. Perhaps I can get Ministry of Agriculture to handle them because they're handling insecticides all the time. Or perhaps I will contract it out to a private contractor for their storage and distribution. What about motorcycles, petrol engines for generators, all these items? I don't want fuel items in my medical store. So those items, again, perhaps contracted out or through the Ministry of Agriculture. Think about what we're doing. Think about the items that we're going to do. It is not one system for everything. Different commodities might have different systems. Perhaps I'm going to do the diagnostics through a different mechanism than the medicines. We have to consider this, and that's why you need time to think in the PSM plan. So the overall message that we're bringing is take time. Plan the plan. Plan the cost of the planning. Putting all this PSM plan together, you probably need a group of 4 or 5 people. Who is going to pay for that? Well, Global Fund will pay if you ask them. You're going to have to consult with different players. You need detail. We need to look at the previous audit reports for your country from Global Fund. What did they say the PSM problems were? Because if I just do nothing about them, they're not going to improve my PSM plan. Look at the audit reports, see what the problem was, see how you can address it this time. How are you going to monitor and report? How are you going to measure these KPI? How are you going to report these key performance indicators? Think it through, look at previous PSM plans, see how they handled it. Okay, I've gone through in just an hour, I see, so let's go now for the second Q&A session. It's often difficult to get sample PSM plans in Nigeria. Is there a link? PSM plans are exceedingly hard to get. Countries do not publish them. They don't like to publish them, but upon request, we will provide you with some PSM plans. you ask directly, we will give you a few PSM plans. They are not readily available. The only country I know that does publish them is India. And you will find the India TB and malaria PSM plans online. Most countries will not publish them. If you want to raise your hand or just type in the chat box any questions. Because pretty soon you're going to have a go at writing a PSM. Okay. If we have a lot of requests, I'll try and put them on the website for you to access. Okay, Manila Vaida, please unmute and ask your question.
Hello, Professor Andy. So thank you for the presentation. It's really very informative. However, we have the two options for the assignment. I don't know if I'm allowed to ask the question for the option A. You know, the assignment, we have option A and option B. This is with the option B. Yes, so that the option A is to identify a challenge and propose a solution to address the current procurement or supply chain issues. Yes, so regarding this option A, we have to follow some the content that to develop this project or like a planning. So what I would like to ask a question on the estimated budget, that like if I develop some the activity, some challenges, and then to address that challenges, we need to develop some intervention, like the proposed intervention to address the challenges. And for each of these intervention, we have to develop activities under is the major intervention that we're going to propose. Yes, and then for that we have to develop some estimated budget. Yes, for each of the activity.
Yes.
Yes, and then we have also, because the budget will be the estimated budget to accomplish that particular activity, isn't it? We don't need to like break down the budget too much detail. Yes. No,
we will give you a simple template with unit costs on the budget. Okay.
Yes. Sorry. So yes.
If you do the option of identifying a problem, you submit your problem first. The tutor will review it. And then part two, he will provide a template to you to help you do budget costing. But it's very basic, just an outline.
Yes, but I have already submitted the one pager, the one pager proposal. And then the Priya is also in the call, and she mentioned that I can go on with my activity, the project. And so I'm working on my project. I believe that it's been approved. The one pager is approved, but I haven't received any template so far, but I'm working on the project.
Please just drop me a line through Priya and I'll make sure you get the budget template. Yep.
Okay, sure. That would be great. Yes, but for rest of the activity, I can go on activity, proposed activity and everything.
Yep. Yes, indeed. Yes, you can go on that route.
Yes.
The problem is it's hard for me to talk about that because everyone chooses a different problem. Everyone chooses
that's why that's why I don't know how you're gonna provide me the unit cost and all. That's why I'm just
we have some basic unit costs, like the cost of a workshop, the cost of a consultant.
Yes, exactly. But the workshop that what we are doing in our project, we are following that basic unit, what's applicable in Nepal as such for the unit costs, So I'm following on that part to develop the budget estimation for each of the activity.
Problem. No problem. Yes. Just drop us a line and I'll send you the budget. Yeah, that's the easiest.
Yes. Do I need to strictly follow the unit cost that you will be providing?
No, you can use your own. If you're happy to use your own budget cost, that's fine.
Yes, I'm using my own unit cost,
That's fine. No problem at all. Happy with that.
Okay, and one more question: do we need to follow some reference, some standard referencing style or something like that, or we can just?
Yes, that should be in the part 2 briefing notes. If you've not received it, I'll send you those as well. Again, just send a quick note to Priya, and I'll send you the briefing notes, which gives you the format layout.
Oh, okay, that would be great. Thank you. That's it from my end, Professor. Thank you once again.
Okay. I've got two questions in the chat box and then I'll come. One is, can faith-based organizations apply? Yes, you have to apply through the country. You would be what they call a subsidiary or secondary recipient. You apply through the country, but yes, quite a lot of faith-based organizations do receive Global Fund grants. Right. Ahmed Sanko, yes, please ask the question.
Yeah, Professor, thank you. Thank you for the lecture. I'm sorry to debate you a little bit. Raising my hand is based on comments, and which will follow later with a request. I don't know if I can proceed.
Yeah, go ahead. Ask
Yeah,
away.
the comments. Yeah, the comment here is. I don't know if in the future you are thinking about putting together a textbook that people who will be taking this course will have the opportunity to have a hard copy printed stuff to be reading while they are taking the online classes, because it's quite challenging for some parts of the world, like my country. I'm in Sierra Leone, basically, and sometimes we have seasonal problems that do affect internet connectivity. So that will also contribute to some kind of delay in people completing the course within the timeline. And the online program is not set to constantly remind people about what time is left. So I believe if people are having textbook, you can even be in the remote places where there is no internet connectivity, and then you have the opportunity to be reading until you come back and have some better internet connection. And lastly, there is a surge recently in Sierra Leone about unaccredited university issuing certificates to Sierra Leoneans. So there is a big dig up, and going through the records that are now coming up for corruption allegations and all of these, there is one institution, the African Graduate College, which is under the microscope now for being unaccredited within Sierra Leone and also in other parts of the country. So it is also good as students that we are taking now the course. You can also share your accreditation with us, because these are also things now that, for example, Sierra Leone, every certificate that you have now, people want to verify and check what is the accreditation of that certificate. So thank you. Let me stop here.
Okay, let's take that. We'll take the accreditation first. We'll find the accreditation. Yeah, can I ask you to mute, please? Yeah, okay. Accreditation. You'll find the accreditation of Empower on the website. It's accredited with ACAS, which is the United Kingdom Accreditation Service for Overseas Universities, and with the Swiss organization. So 2 organizations fully accredited. You'll find those certificates on the Empower website. Okay. Textbook. In the resource material, you have Managing Drug Supply. It's downloadable, it's searchable, it's 1,080 pages. I think that textbook is enough for everybody. You'll find all the information, all the detail you need in there. If it's not enough, there's also the 460 pages of the JSI Logistic Manager's Handbook. That's in the resource material. It can be downloaded. You can access it offline. You can search it offline. All you have to do is go to the resource material and download it. If we send you the book, Managing Drug Supply, printed copy is around $270. It weighs 2.5 kilos, and it would cost us about $70 to send it to you. So it's very expensive. That's why we use the electronic versions, which are in the resource material and are downloadable. The full book, Managing Drug Supply, and the JSI handbook as well. Okay, I hope that addresses those. Midas Kamanga, you do not need to put the values in the global fund template. If you want to estimate them, that's fine, but as for the case study, you don't need to do that. We think it's too much. It would be a lot of quantification work for you. Just try and complete the PSM plan. Lots of people have asked for copies of the PSM plan. Okay, we'll make them available. Do not try to copy and paste them. We will find out if you do that. Get the idea from them. Think about your country. Think about what you're going to do to solve the previous problems. Okay, Ahmed, I think you've already spoken. Okay. Any other questions? See if I can see any hands. I don't see any hands. Will we get another session to support with the case study? If you ask for it, we can do. It's difficult if you want to identify a problem and solve it. It's difficult for me to talk about that because every problem is unique. So I can talk about PSM plan because that's all the same. But I perhaps could do a few examples if you want. But if you request it, we can do that. Okay. Any other questions? You can just unmute and ask the question if you want. A secondary recipient, okay. When a country makes a grant application, one body in the country is appointed as the principal recipient. That's usually the Ministry of Health. They will apply for the grant. Now, the grant might be for HIV, and there might be 5 or 6 organizations working on HIV. Each of those organizations could be a secondary recipient. So there might be a faith-based organization that's doing things on HIV. There might be the ministry itself that's doing things. There might be a private HIV program. There might be NGOs that do things on HIV. All of them can be secondary recipients. The role of the principal recipient is to put them all together and make one combined grant application from the country on behalf of all the secondary recipients. I hope that makes the point. So the principal recipient would make the PSM plan, and he might decide we will supply the medicines directly to the sub-recipient. Let's say it's an NGO. I'll give the medicines to the NGO and they will distribute in their own way. I will need to detail how the NGO will do it, what warehouse space they've got, what reporting mechanisms they have. But basically, the country is the principal recipient. The implementing partners, the stakeholders in the country, can be the secondary recipients. Please share the slides. Yes, of course, all the slides will come to you. If you want to ask a question, perhaps just unmute and ask. That might be easier for you. Midas Kamanga, you have a question?
Yes, hello, Prof.
Yep.
Hello, can you hear me?
Yes, go ahead.
Oh, yeah, so concerning on the same assignment, I think last time on module 9, we had an essay. So up to now, I haven't heard from you. And I also submitted the first page of the PSM plan you said before we started. And up to now, I haven't heard from you. And I think I just want also to know, you said that we cannot go ahead with the PSM plan, the template, unless we hear from you. So I don't know the duration that you mentioned, 20, you said about a month. This case study is for 1 month duration. So I don't know, where does it start? It starts when you say go ahead, or maybe once we have reached this module.
It starts when we say go ahead. Don't worry, we're not going to cheat you on the clock time. And I'll just coordinate with Priya to find out what's happened, because I haven't seen any management essays or any front pages, but I'll check with Priya just to make sure that that's happening.
All right, because it has
don't
been
don't be afraid
now.
to send. Don't be afraid to send a reminder if you're not getting a response. Yeah.
All right,
It's
I
okay,
did
just
it
to
to
send-
Priya. Priya just
Okay.
said, a moment, I'll come back to you.
Yeah. Well, Priya's on the call, so I'm sure she'll take notes. And
All right, thank you.
okay, no problem. Is there anyone else that would like to ask a question? Okay, so I'll make some PSM plans available and I'll get those uploaded and we'll notify you of the link available. But again, please don't try to copy and paste them, read them, get some ideas of how to address issues. Okay, last chance for questions before we close down. Okay, then thank you all for joining us today. I wish you a good morning, good afternoon, good night. Eid Mubarak to all. Happy May Day. And good luck undertaking this assignment.
Thank you so much, Prof. Andy, for this presentation.
Thank you, Professor. Bye-bye.
Okay, bye for
Thank
now.
you so much, Prof.
Bye.
Bye.
Yeah.
Thank you, Prof. Hope to talk again next time.
Thank
I don't know
you. Bye-bye.
whether this is the last one. I
Have a
don't know.
good day.
If you request more, we'll do more. It's okay.
Thank you so much.
All right.
Thank you. Bye-bye.
Bye.
Bye.
Bye. Thank you so much.
Okay.